we implemented IORT in early 2012, and currently treat about 100 patients yearly out of 1,500 patients referred for surgery. So as you can see, patients are highly selected based on clinical and pathological factors. So that's why it's a little less than 10% of patients. Patients eligible for IORT are those eligible for partial breast irradiation, and they have to meet the criteria proposed by both the ASTRO and JECASTRO. And those are patients at least 50 years old with P1 with T1 and 0 non-globular grade 1-2 tumors without lymphovascular invasion, without extensive DCIS, and ER positive and HER2 positive. So currently we use the INTRABEAM system, namely 50 kV photon beam, delivering the treatment in an isotopic shape. In this department, we are 8 radiation oncologists. Not all of them practice IORT, but sufficiently to have each day of the week one of our radiation oncologists dedicated to the IORT, making a radiation oncologist and a surgeon pair. So the surgeon and the radiation oncologist each meets the patient, checking for her eligibility to partial breast irradiation in IORT, setting forth all the various radiation therapy possibilities, different options, and collecting the patient's wishes. Then we inform the physicist team for them to put this appointment into their agenda. So we use a visual option grid describing all radiation therapy possibilities in this setting, from conventional external beam radiation therapy to radiation therapy omission. This option grid describes the treatment delivery, the side effects, the control rates, the importance of adjuvant endocrine therapy, and also the different salvage treatment that can be offered in the case of a recurrence. The most important is to appropriately select patients and not allow for any deviation. Otherwise, you could have higher local recurrence. But the main advice, except for patient selection, is to broach the issue of endocrine therapy before any treatment decision, because endocrine therapy is always recommended, but a large proportion, about 40% of patients, abandon this treatment within the first 2 years after starting it. And in the case of partial breast irradiation, the omission of endocrine therapy would lead to substantially higher risk of local recurrence. And in patients not motivated to pursue it, I think they should not be offered IORT or PBI. I would just emphasize our results in patients with in patients eligible for IORT, who are treated with IORT alone and endocrine therapy, who experienced a 5-year of a recurrence rate of 1.5%, which, in my opinion, is validates this treatment option.